I'm Melanie Black with the Potter Valley Humane Society. Holding a clinic within a clinic is real simple. Using an existing facility such as Dr. Chitwood's office here, everything that you need is here, and all you have to do is bring your heating pads and your staff. Upon arrival at the clinic, the owner will bring in their paperwork that has already been sent to them and pre-filled out and money sent back, so that we know how many animals are coming, how many cats, how many dogs, how many spays and neuters. It is given to the receptionist, who also works for the Humane Society, and she fills out the paperwork.
A piece of tape with the owner's last name and the animal designation is attached to the front of the cage. A similar tape is put on the animal's head and the forms are placed on top of the cage. Animal and cage identification are very important. Avoid putting a lot of extra information on the tape, as the paperwork will remain with the animal and the carrier throughout the day. The ID tape simply makes sure that the correct pet, cage, and paperwork remain together.
Once the paperwork is completed and the animal has been identified, we take it to the holding area in the back.
And now being processed through all the paperwork, they have the tapes to identify them that are on their backs. So even during surgery, they will be identified. They've been put back in their kennels that the owner brings them in, and then the proper paperwork is attached to the top of the kennel, so it makes it very easy to keep track of them, and so that there's no mix-ups. They'll go back now for their surgery. They'll wait for their surgery with the others.
Weighing pets will be part of the clinic day. Usually this procedure will be in different locations for dogs and cats.
13.6. There we go. Okay. Thank you very much.
No, you're not interrupting anything.
Okay. Let's go ahead and get Rusty situated here, so that he can wait here for his surgery. Yes, sir. And we will put this paperwork, which will follow him all the way through, on his kennel. And now, there you go. He's ready for his surgery.
Paperwork will remain with the pet. For generating records, most organizations use duplicate or triplicate copies. Do not separate the carbonless forms till the end of the day, or the copies will ultimately contain different information.
We sort them male and female. Generally we have 2 doctors working at a time, one doing neuters while the other does spays, and then when the neuters are done, that doctor continues on helping with the spays. The dogs are kept back in the large kennel area, either in the large kennels up off the ground, kennel banks, or in runs, depending upon the size of the dog.
Now our day has moved past check-in. Animals will be prepped for surgery while other animals are being monitored in recovery. At the same time, supplies are being cleaned, cages are being cleaned, and paperwork for rabies certificates is being completed. Inserting a trachea tube before surgery as part of the preparation process will normally be done by the technician or assistant who works at the animal hospital. Here we see a medium-sized dog being carefully strapped to a stretcher to be returned to its cage. Again, make sure that the tongue is gently pulled to the front of the mouth so that the airway is not blocked when the animal is laid in the cage. Here we see a large dog being carried in a blanket. This method cradles the dog so it's not tied or strapped in.
Some of these were donated to us. They're kennel-oriented type stuff, and then you just take the heating pads out and throw them in the washer and wash them when you're through. But this way it facilitates them in their recuperation and helps keep the body temperature down.
The role of the volunteer in recovery activities may vary from state to state according to state laws. Generally, monitoring includes being aware of whether the animal is maintaining body temperature and heart rate and is breathing properly. Gums should be pink and extremities warm. The activities involved in recovery must be under the direction of a licensed veterinarian. Throughout the day, volunteers will also monitor laundry, washing, drying, folding towels, heating pad covers, etc., and washing and packing surgical instruments to be sterilized in the autoclave are all ongoing activities. Washing and repacking surgical instruments, usually called packs, will normally be a volunteer activity. Some animal hospitals place the instrument packs in plastic pouches meant to be used in an autoclave. Other hospitals will double wrap them in blue towels, commonly referred to as huck towels. Here we see the cleaned instrument pack being placed into the pouch. Gauze will normally be sterilized with the instruments. The filled pouch will now go into an autoclave, where pouches will be sterilized with a combination of heat and pressure. Here we see the instruments being wrapped in a huck towel. The instruments, along with gauze, are wrapped like a burrito, and the final tab is tucked in. The packs will be wrapped in 2 separate towels, and the tabs will be sealed with tape designed for this process called autoclave tape.
When the client comes in and the owner fills out the information form, on here it'll say whether or not the animal needs rabies. The information off of the rabies bottle, it's Fort Dodge, I believe it is on this one, the manufacturer, the date expired, the serial number, and the vet's ID number, which you can get from your veterinarian. Along about noon, you do get hungry, and of course sometimes you just work on through thinking, well, I just got a few patients, but you get short-tempered, your blood sugar seems to go down, and of course working with the animals, you have to stay on your toes. So keeping your sugar up and sitting down and eating a good meal is a must. Now, a lot of our restaurants in our area provide meals. About 2 weeks before the clinic, I get it approved as to which company is going to donate the food. So that way we're not out a lot. It's important to remember that you are a guest in each clinic wherever you're at. So in keeping with being a good guest, it is important that you keep the kennels clean. Any kennels that we use, we clean out the paper, wash them down, and put fresh paper in, just like when we first arrived. Make sure that everything is clean, just as when you came in, whether it's the countertops, finishing the laundry up, finishing washing the utensils for the tech to pack and sterilize. But also remember that the surgery room has to be cleaned. The tables have to be cleaned, making sure that there's no blood. The trash has to be taken out, and the counters cleaned as well.
This little baby is going home, and he needs to be kept warm, and we're just trying to get him back to his owner and get him home and get him comfortable. But he's doing great. He's doing
This little kitty has just come in from the first recovery area and is going to be waiting here for its owner. I'm taking the paperwork and making sure that all of the information is transferred to the owner's copy and to the vet's copy. And then I take this for my records. And I make sure that the client's is attached to the pet tag. And that's basically it. Until the owner picks it up.
I'm here for cuddles. Can I have cuddles by Sunny
I've got some aftercare instructions for you. Okay, this is your vaccination certificate. This is your aftercare instructions. You need to keep your pet warm. Don't put her where she's in a draft.
Read the aftercare information to the client out loud and discuss basics like keeping the animal confined, comfortable, and warm enough. Make sure the client understands instructions fully, especially if medication is sent home. Verbally review feeding instructions, especially regarding pediatric surgeries. If the animal will not be in the house, make sure that the guardian understands that the animal will be impaired and cannot wander loose. The pet could be injured or become prey to other animals.
Maybe keep her warm above all else. Keep her inside if you can until she's not groggy anymore. Don't give her anything to eat or drink tonight.
This is a great example. You can see here that Lou is making eye contact with the client and waiting patiently for him to acknowledge the instructions. They're having a dialogue about the care the pet will need. If the client is visually impaired or cannot read, circle the aftercare phone number and be sure to show the circle to the client or a family member or caregiver. Aftercare forms approved by your veterinarian should be easy for clients to follow and include regular and emergency instructions. If the client is picking up a cat and does not own a carrier, take the cat to the guardian's car in a Humane Society pet taxi. Remove the cat in the car and return the carrier to the clinic. Encourage all cat guardians to at least have a box or pillowcase for their pet.
You can give them some water tonight. Don't feed her today. Tomorrow you can start feeding them.
We have so many unwanted animals, and until we educate people on the importance of spaying and neutering, then it's just going to get worse. All of my animals that I have presently, I have 12 cats and 3 dogs, and all of them were abandoned.
What do you see as the importance of a sliding scale program?
I think it's wonderful. It allows everyone to have the opportunity to have their animals taken care of, whether, regardless of what their income is.